Okay. So I chose to design this presentation looking at our emergency drug boxes because it's something I'm interested in as a critical care resident, but a lot of our pharmacy technicians working in the inpatient pharmacy work at refilling these boxes, checking for expired meds, so it's something that is relevant to many of our technicians. And I just wanted to kind of run through, mostly looking at the drugs to see what's in the box and what are these drugs actually being used for out in the field. So today we're going to investigate the contents of our rescue squad boxes. We'll differentiate between the different supplies in the box and the medications that are used in emergency situations. So here's a picture of what our sheet looks like, the paper that we work off of, and it shows the layout of the drug box. And we'll start with the top drawer and just work our way down. So in our first drawer, our first little pocket, we have a bunch of needles and syringes, and then a three-way stopcock, which can be used to quickly access two different syringes. There's various uses, but typically you'd hook up two different syringes, and then the third site would go to the patient or to a third syringe. We also have other supplies, a tourniquet, which you see wrapped around the arm, which would help prevent hemorrhage if a patient is actively bleeding after a trauma. Alcohol prep pads are important to sterilize a site or a vial before using the medication. Gloves, obviously, because we want to protect ourselves, but also to protect the patient. And then sterile gauze. Again, that's to wipe away blood or other fluids, to clean a site after a trauma, or to stop bleeding after you inject someone with a medication. And then we also have extra syringes. We have tape, which is used for a variety of things. Ultrasite access port, which is used to help prevent needle sticks. This allows you to easily just screw on a syringe so that the patient doesn't accidentally get stabbed, or you don't accidentally stab yourself when dealing with multiple needles. And then there's tubes to draw blood cultures or other labs, which are often necessary, more alcohol pads, and sterile water or normal saline, which can be used to reconstitute medications. And then in our next drawer, we get into some of the medications. So first we have diphenhydramine or Benadryl. This is an antihistamine. It's used typically for anaphylactic or allergic reactions. And we have to be careful in some patients. If they have asthma, it can thicken some secretions. Patients with a cardiac history, it can cause some tachycardia or palpitations. But generally in emergent situations, we're going to administer the drug because the benefits are going to outweigh the risks in these situations. And as far as side effects, it can cause some drowsiness, some sleepiness. Some people actually take Benadryl to help them fall asleep at night. So that's probably the most common thing, but also palpitations or hypotension can also occur. Morphine, you'll notice the two big red stars. That's because it's a controlled substance. So when you're refilling the rescue squad boxes, you'll notice that if one of these is expired or has been used, the pharmacist has to actually pull it from the Pyxis machine. It's not kept with all of our other medications. This is an opioid, so it's used for pain. But unlike some of the other opioids, this is used preferentially for cardiac indications because it causes some vasodilation, which helps increase blood flow to our heart. So it's typically preferred in patients who are having a heart attack or an MI. Like most of our opioids and a lot of analgesic and sedative medications, it can cause respiratory depression, so it's going to decrease that patient's ability to breathe on their own. It can also cause some slowing of the heart rate, decreasing the blood pressure. And in serious situations, it can cause an anaphylactic or allergic reaction in some patients. Midazolam is a benzodiazepine, so this is used for anxiety or sedation. Similar to the morphine, it can also cause respiratory depression or hypotension. And again, you'll notice the two big red stars. This is another controlled substance. Ketamine is also used for pain or sedation. Again, a controlled substance, so it's kept locked in our Pyxis machine. This is a little bit different than some of our other medications for analgesia or sedation because it doesn't really produce hypotension and respiratory depression. It can actually be stimulating and cause hallucinations or increased heart rate, increased blood pressure. So that's something unique to ketamine. And then fentanyl is the last of the controlled substances we keep in our rescue squad boxes. Again, this is an opioid, so it's used for pain control. Similar to the other medications we've discussed, it causes respiratory depression, hypotension, bradycardia, which is a decreased heart rate. So our first learning question today, which of the following is a common adverse effect associated with midazolam? Which one? Yes, good, A. All right, moving along, our next agent, tranexamic acid, or sometimes abbreviated TXA. This is classified as antifibrinolytic agent. It's to help stop bleeding in trauma patients. And it's specifically indicated for trauma patients who are having significant bleeding, which is characterized by a systolic blood pressure less than 90 and or a pulse greater than 110. And it's very important to get this on board quickly. So if we'll try to administer it out in the field if possible, but if that's going to slow down the patient's transport to the hospital, it's more important to get them to the emergency department rather than trying to administer this medication. So we'll only give this early in the trauma. If they've been bleeding, for 12 hours and they're still bleeding, we're not going to still administer it. But early on, it has been shown to help stop that bleeding and has good patient outcomes. Magnesium it's an electrolyte. We all usually eat magnesium in our diet. It's in a lot of foods. But we carry vials of it in our rescue squad boxes for certain emergencies, specifically eclampsia and preeclampsia, which are emergencies in pregnant patients, and torsades, which is a certain type of arrhythmia that magnesium has been shown to help cure this arrhythmia or help bring the patient back to a normal rhythm. It can cause some flushing and hypotension when administered quickly, but for these emergent situations, it's important to administer it, so we will still give it pretty rapidly, even though there is a risk of these side effects.
So can you directly push the magnesium, or it has to be in a drip?
No, for these emergent situations, we will give it as a bolus. For typical just when we're doing electrolyte replacement, so if we're checking labs and a patient's magnesium's low, then we'll give it as a drip. Nitroglycerin. So we have a couple different formulations. We have nitro paste, which can be rubbed on the patient's chest, or we have sublingual tablets, which they just put under their tongue, and it gets absorbed through their mouth. This is used typically for chest pain, but also for hypertension. It causes vasodilation, so our blood vessels kind of loosen and widen so that our blood pressure is going to decrease, and that helps by increasing blood flow to our heart, which will help decrease that chest pain, but also it'll relieve high blood pressure. A few things to watch out for. It can cause hypotension because it can cause a pretty severe, significant decrease in blood pressure. It can also, it's contraindicated in patients who are taking certain medications like Viagra for erectile dysfunction, because these medications, when used together, kind of have an additive effect on decreasing blood pressure. So it can cause a very significant decrease in blood pressure. And this can also cause a lot of flushing or dizziness. So aspirin you're probably familiar with. This is an antiplatelet or analgesic medication or antipyretic, so it'll help relieve pain and help reduce fever and also prevent blood clots. You have to be careful in patients with a trauma because they could have, if they have an active bleed, we don't want to give them something that could worsen that. Also, if they have, GI bleeding and they're bleeding in their stomach, we don't want to worsen that. Some patients have allergic reactions to aspirin, so we want to be careful and think about our patient's past medical history. But generally, this is a pretty benign drug that many patients are on it just for risk reduction. So if they have any cardiac history, a lot of times they'll take a baby aspirin every day. But generally, we'll use this when someone is having an acute cardiac episode. So if they have chest pain and we think they might be having a heart attack, we give them aspirin. Lidocaine is a local anesthetic. So this it can be used, there's several different formulations, but what we carry in our drug box would be given either IV or subcutaneously. It can either be used as a local anesthetic for procedures, so it kind of numbs that site, and so whatever procedure they're having would be less painful for the patient. But it's also used as an antiarrhythmic, so patients with cardiac arrhythmias, lidocaine can be used in certain arrhythmias to help control that arrhythmia. When patients are on it more longer term, when they're getting the IV formulation, then we sometimes have to monitor levels, because high doses for long periods of time can cause some pretty severe side effects, including seizures and coma at very high levels. Amiodarone is another antiarrhythmic drug. So this is used in patients with cardiac arrest or other cardiac arrhythmias. It's important that if a patient, unless they're in cardiac arrest and do not have a pulse, we don't want to give it IV push, because it can cause significant hypotension and can actually cause them to go into cardiac arrest. There are some other side effects, including bradycardia or arrhythmias, but this most commonly is used in patients, as I mentioned, with cardiac arrest or atrial fibrillation and other arrhythmias. Epinephrine, there's actually two different formulations that we keep in the box. One of them is the 1 to 1,000, and the other is 1 to 10,000. So one of them, you'll notice it comes in a vial and you have to draw it up, and the other is already in the syringe that you just screw it together and administer it to the patient. So that would be this 1 to 1,000 that we can administer during a cardiac arrest, and it can be given IM or IV. Dopamine, I didn't mention, epinephrine is a vasopressor, so it's used to increase, it causes an increased heart rate, but also increased vascular resistance, so our blood pressure will go up, our heart rate will go up. Dopamine is another vasopressor, so again, patients who have hypotension, we can give them dopamine to help increase their blood pressure. It can cause a lot of arrhythmias, so we have to be careful with patients who have a history of cardiac arrhythmias. And similar to our other vasopressors, it can cause tachycardia. Glucagon is used in patients who have hypoglycemia or low blood sugar. So in our rescue squad box, it comes with the vial of glucagon as well as a vial of sterile water. So you have to mix the sterile water and the glucagon before you administer it. Haloperidol is an antipsychotic agent. So this is generally used in patients who have severe agitation or behavioral problems. If they have a psych disorder and they're agitated in an acute setting, we can give them a dose of either IM or IV haloperidol to help calm them down and restore their normal mental status. It can cause a lot of movement disorders. So there's this extra pyramidal symptoms, which manifest as some sort of shakiness usually, and it can also cause some arrhythmias. Ondansetron or Zofran it comes either as an injectable form or as tablets, and this is to prevent or treat nausea and vomiting. This can cause some cardiac arrhythmias, so we have to be careful in some patients, especially if they're on other medications which can cause this QT prolongation. That's a type of cardiac arrhythmia that we can notice on an EKG when we're monitoring their their cardiac rhythm. Methylprednisolone and prednisone are steroids, so they have a lot of potential uses, but generally in emergency situations, what we're using them for are either bronchospasm associated with COPD or respiratory issues, or allergic reactions when a patient has severe swelling. Often, if their airway is swelling up, we need to quickly find something to reverse that inflammation. The adverse effects listed here are mostly with long-term use, so if patients are on them chronically instead of just a single dose, but it can cause a lot of hypertension, swelling, mood changes. Metoprolol is a beta blocker, which is a type of antihypertensive or blood pressure medication. But in addition to lowering their blood pressure, this medication also lowers their heart rate. So it's used for a lot of, specifically atrial fibrillation, to help decrease that heart rate. So it's used either for this arrhythmia or for hypertension. We have to be careful in patients that have either low blood pressure or low heart rate, because giving this could potentially bottom them out. All right, moving on to the third drawer. Atropine is an anticholinergic medication, so it's used in patients who have very low heart rate or bradycardia. It also has a few specific indications in certain exposure to toxic substances. But generally when we would use this is if a patient has bradycardia and we're trying to bring back up their heart rate. It can cause a lot of similar symptoms to the Benadryl or diphenhydramine, which we talked about before. So it can cause some blurred vision, some dry mouth, some tachycardia or palpitations. Adenosine is another antiarrhythmic medication, so it's used for certain types of tachycardia or fast heart rate. It's not useful in atrial fibrillation, which is a common arrhythmia, but for other types of tachycardia, it can help bring them back to a normal sinus rhythm. And this medication can cause some transient or short-term flushing and chest pain or tightness. Cefazolin is a type of cephalosporin antibiotic. So this is generally used in patients who, in the hospital, we would use it for a lot of different types of infections, but in terms of the emergency rescue squad box, patients who have an open fracture, we use this as a prophylaxis to prevent them getting infection, because whenever you have an open fracture, you have normal sterile tissue inside you that shouldn't be exposed to all the dirt and bacteria from outside, but this will help prevent that bacteria from getting inside and growing. One thing to watch out for is some patients, if they have a history of an allergy to either a cephalosporin or a penicillin, because they're similar classes of drugs, we need to be careful with this antibiotic. Calcium chloride is an electrolyte. There's a few different indications for this. Hypocalcemia, so if they have low calcium levels, we can use calcium to help replete that or replace that. But also if they have hyperkalemia, so high potassium, or hypermagnesemia, high magnesium levels, giving calcium chloride can help prevent some of the negative effects on our heart. So it's sort of cardioprotective in these situations. And then patients who have overdoses of either beta blockers or calcium channel blockers, we can give calcium to try to reverse or prevent some of those negative effects. If we administer this too fast, it can cause hypotension or bradycardia, and it's painful if we give it IM, so really we should only give this IV. Naloxone or Narcan, it's actually available over the counter now, but we carry it in our rescue box because it's used for reversal of narcotics. So our opioid pain medications, if someone takes too much, they can go into respiratory depression, causes significant hypotension, bradycardia, and it can be fatal. So giving naloxone will reverse the effects of those opioids and bring the patient back so that they're responsive. The downside of that is if you give too much, it can, and you give it quickly, which generally you need to, It can cause them to go into withdrawal, so the patient can actually become very agitated. They can become nauseous. They might throw up, and they'll become tachycardic, hypertensive. But that's much more important to reverse the effects of the potentially fatal opioids, even if they might experience these effects. Here's the other formulation of epinephrine. You see the box here with the pin that would you just pull it out and screw it together. We already kind of talked about this before, but it's a vasopressor. It's going to increase your heart rate and blood pressure, and it can cause some arrhythmias, cardiac arrhythmias. So our next question: which medication is used to treat opioid overdose? Good. C, naloxone. Here's a few more of the medical supplies in here. On the left, you have a mucosal atomization device. So certain medications, you can actually give it intranasally, and this device that just screws on to the end of the syringe, just when you expel it through the syringe, you can sort of see the picture there, but it just sort of breaks up the liquid into something that you can take intranasally. Yes, so with our naloxone, it can be given by this method. That way, it can also be given IM, IV, but that's just one way that you can just administer it to the patient that way if you don't have access. And then in the bottom of our box, a couple more things left. We have sodium bicarb, which it can be used as an electrolyte replacement if a patient's bicarbonate level is low, which we can check either in a blood gas or sending a blood sample to the lab. It's also used in acidosis. So if patient has, we can check the pH of their blood and determine if it's within normal range or if we need to administer a medication such as this. Dextrose, which is given for patients with hypoglycemia. So sometimes if they take too much insulin, a brittle diabetic patient might become hypoglycemic, their blood sugar's low. We give them dextrose to bring their sugar back up. Ipratropium is a bronchodilator or anticholinergic agent. So it's used for asthma or COPD when the patient has a bronchospasm. Albuterol is also a bronchodilator, a different class. This one's a beta agonist, also used for asthma, COPD. This one can also be used for hyperkalemia, which is high potassium levels. And then there are a few other medical supplies in the bottom of the box. There's an extension set, which is just really to extend the length of your IV tubing. We have multiple bags of normal saline, which a lot of times patients need fluids, depending on what kind of accident they've had. Larger syringes for some of our medications. We have a Sharps container, which is important because anytime we are using needles to draw up medications or to inject things into the patient, we don't want that sharp object just laying around because someone could hurt themselves. What else is up here? The arm splints. So if a patient fractures their arm, use these arm boards to keep it straight and flat. Which of the following is used to prevent excessive bleeding following trauma? Good. Tourniquets. Any questions? Sorry, I kind of ran through that since we're a little short on time, but